but not yet apparently.
Yeah, something happened where county IT is streaming it today, and something happened where someone logged on for like 3 minutes and it kicked us off.
Oh,
Yeah. Welcome to the days of technology.
Yeah.
Reliant on technology.
Phyllis said I'm trying.
Okay.
Yeah.
Thank you. We'll let you know when the other two are back.
All right.
Amy's cell phone number right away.
Yeah,
I have it. Well, I guess I'm back on. I can't see it. Oh, wait a minute.
I hear you.
I'm on, but you won't see me.
Now, do you see me?
No.
Okay.
I see your charming face.
Phyllis, you're on.
Right. Well,
Hi,
let's
guys.
see. What was I saying?
Were we ready to try this again? You guys can go ahead and start streaming it, please. All right, thank you.
We were right in the middle of your comments, Phyllis, if you could pick up where you were.
My tirade.
You were talking about research with ABA.
Right. And what I discovered from several people who have had experience with this is that it is extremely beneficial to severely autistic children to get this, and many times they are able to pretty well fit into a regular classroom, whereas without it, sometimes parents don't do anything until, well, they don't know how to take care of the child, or they aren't aware of services until they start maybe pre-K at age 4, and by that time, some of them are unmanageable. And I think, well, according to my daughter who worked part-time in one of these classrooms, there was a constant stream of burnout and workers' comp claims because of abusive treatment by the children and et cetera. So I'm much more inclined to spend this amount of money on 2 children. But I would like to hear others before I cast a yes or no vote.
I would like to take this particular item off our budget right now, table it, and ask for more research and information. I want to know what the success rate is. I want to know how the children are selected. I think it sounds like a wonderful program, but I hearken back to the fact that we are spending taxpayer money. It is not grant money. It is not private money. And are we being, when there are other pediatric therapy services like what Easter Seals is doing, can we serve more children with tax dollars and somehow do it in a different way than just spending it on 2 children? But I need to know. I believe everything you say, Phyllis, but I would like to have some printed material so that I can reference that if I were asked why I spent $92,000 or whatever on 1 child.
I agree with that. And what I forgot to say is I don't really think this was explained to us in detail. And I agree with Mary. I need to know more about what the program encompasses. And I do know that, or at least I believe, these programs are not provided by public schools. I know they have been in some areas, but I don't think they are here, at least.
We're trying to find out. Yeah, I'm trying to find out. Yeah.
So I agree, Mary. I think I need to know more about the specifics of this program, but it sounds like it would be a great program and a great aid to our public school system.
I agree, but I also would like to have figures on when a child is entered into what the rate of children staying with the program and not dropping out and then starting over with another child, you know, from beginning to end. Do they stick it out? And how are the families screened to determine who receives these services?
Also, Phyllis, you said that you thought this would be for the whole family. I didn't understand that because there's so many. That's something I'd like to know. How is the whole family involved in this? Easter Seals program is for training the family, and this one is for training the child.
But they go into the homes and work. So when they're in the home, they're working with the entire family.
Is entire here,
This takes place in the children's homes.
right?
So
But
they would be working with everybody.
don't the children go to some site each
Right.
day?
That's what I thought. I thought they were.
So with ABA therapy, it's specific to children with autism or that have behavioral.
We can't hear you,
specific
Amy.
behavioral.
You're breaking up, Amy.
Can you guys put if you guys go on mute, it might help.
Okay.
So with ABA therapy, they go into the home and it's 35 to 40 hours a week. The child would sometimes go into the center also, but it's really like showing the family how to engage with that child and how to interact with that child in a way that would be best results. So for example, with like children with autism or some other type of similar challenges, because of so many, the way that their brains work, because of so many challenges, they can't do normal functioning, like sitting at the table for supper with the family, or for example, like my youngest, he couldn't wear a coat in winter. So there's so many sensory things that go along with it. So then it's like so it's really like, it's working with the family to work with the child. So it's not just the therapist coming in and like getting this child to do things. And the other thing too, like the kids to my recollection, it was in their application as far as how they selected families, the criteria to be in there. So some of the questions I think may have been answered in the application. But so it's really like, if you picture the children that would be selected for this, these are children that cannot operate in normal daily functions. So it may be like, for example, my oldest, he couldn't do school. He would go and lay under the desk. He couldn't participate until there was a BCBA therapist that came in to explain to the teachers how to engage with him, explain to us how to engage with him in a way so he would actually engage with the class. So it's very, very simple things that we take for granted that these children are not able to do. And so then the therapist is teaching those families how to do that, and also teaching the kid how to be able to process their sensory integration. So for example, like the lights are hurting my eyes, so I'm freaking out and crying. So it may be something as simple like turn down the lights, teaching the family to be more mindful of sensory, turn down the lights, give the child sunglasses. So it's working with the family. But another example too is with my, I have 2 children on the autism spectrum. And And at this point, I'll just be very open. So we see we choose psychiatry to help us. And so even with child psychiatry, 95% of the appointment is the psychiatrist explaining to us how to engage with our children. So anytime you're talking about any of these family therapies, especially for children that have some type of developmental delay or disability, is working with the families to have that higher quality. And it's also working with the child to see if there's other things going on, like what is the purpose of their behavior? So if they're screaming every time they go to Walmart, they're just losing it and screaming, it's looking at like, why are they screaming and losing it in Walmart? And then being able to troubleshoot that so that they can have successful trips to even like the grocery store. So I hope that kind of explains it more. And so I think just from recollection in the application, they talked about some of the specifics. And as far as the success rate, it is an evidence-based program. So then that means like there has been research done on ABA. It is the best practice for children that have challenges similar to autism or autism. And so as far as like engaging with families, there's a process that they would be screened to make sure that they have the ability to be able to follow through. There would be support to help them with following through. I mean, there's no guarantee that there wouldn't be a time where like that family would have to pull out. But the other piece of this too is ABA is best practice for these children. However, Medicaid doesn't provide any type of reimbursement on this. And so that's why it's so expensive, is because our Medicaid doesn't, our Medicaid system, our public health insurance doesn't provide any type of assistance with this. And most of the children that would need ABA, their families are not able to work. At least one of the members isn't able to work because they end up having to stay home with the child to take care of the child because the child's getting kicked out of daycare. No one is able to take care of them. So a lot of these families, unfortunately, are utilizing public health insurance because of the challenges associated with having that child on the spectrum.
I had an opportunity to go to the open house at the at Carl Broman, and that facility is in the lower level of the walkway as you go over and before you get to the hospital. And my understanding that day was that a significant amount of this was there is a special room that had been developed, and they were showing how that actually was a kind of the center part of that. And I did pick up here in their application that the program is scheduled to relocate to the Carl Broman campus in November, which it did. It says that the new space will allow us to expand our physical, occupational, speech, and ABA services. And then it says the other locations for therapy services are natural environments, which may include the family home, daycare center, or park. So I think the majority of the actual time spent with the child is actually at the Carl Broman Center, which is in that lower level.
But that's without the parents.
I
Probably
don't know if the parents, I don't know the answer to that. It would seem to me that maybe a parent would be with them.
Right, the parents would, ideally the parents would be able to go to that with them, and or there would be, even if they're just working directly with the child and not the parent, after that session, there would be a staffing with the parent to go over that stuff. So whatever you're teaching the child, it can't just be done in that therapy session. It has to be, the parent has to also do the same thing. So like a horrible example is like, if you've got, like I have a puppy right now and we're trying to train her. And so we all have to do the same thing to try to train her. So it's the same thing with these therapies. It's not going to work if it's just the therapist doing it during that time. They're training the parents to do the same thing, and they're staffing, talking with the parents after the appointment, saying, if during that appointment, if the parents aren't engaged, they're saying, hey, this is what I learned. Can we try this? And so it's constant contact, communication. And they also, Mark First and Easter Seal said, especially during this pandemic, families are calling all the time, like, my child is doing this. What am I supposed to do? The school is telling me this. What am I supposed to do? So there's constant family engagement on, of course, they have to work with the child to see what's going on and how to maybe overcome some of those things, but they're not going to do anything with the child and then keep that from the family. They want the family to be practicing the same things.
But we've raised good questions, which it's fair to ask for answers on these.
As I said before, I'm not opposed, but I want more information. And so if it's appropriate, I would move to have this item taken off our budget and tabled.
Okay, the
I'll
motion.
second.
Thank you. The second's been made. Any further discussion?
I just want to make sure that I have the correct information that you guys are seeking from Mark First. And then I'm assuming then there would need to be a meeting in December, because if this is to start in January. So you guys want to know the success rate, the rate of most families continuing to be engaged and not stopping services, how the children are selected, how the families are screened, and more about what the program encompasses. Is there anything else that you guys need to know to help you make your decision in December?
Are there children in this program that are being supported by private health insurance? That
No, no. This program,
is this program only for low income?
are you talking about the money received from the 377 board or the program as a whole?
The program as a whole.
Right, there are children that have private insurance that are in this program too.
And how much is private insurance paying?
Yeah.
Okay. So
But
you
whatever private insurance,
up with their
whatever private insurance pays doesn't affect our funding, does it?
But it's a comparison to how much, private insurance is paying compared to what the rate for indigents is.
I'll bet there are people who pay privately, totally pay privately too.
But $92,000
I bet there are, Jan, because
is,
I don't think we realize how severe some of these children are. I believe this is for the very severe children. Now, I could be wrong, but we just need
No,
more
it's for the-
information.
Yeah, it's only for the children that are very severe and families do become very desperate. And if they have the money to just do it, they will do it.
Okay, we have a motion on the floor. All in favor, say aye.
Aye.
Oh, sorry, we have to do roll call for
Okay,
that. Phyllis,
Yes,
Mary Casely,
Yes.
or McGinnis,
yes.
and Jan Hood.
yes.
Okay, thank you. We'll move on to Mark First supported employment. 180,000.
I don't have any questions about this, so I would make a motion to approve it.
I second it.
Okay, there's a motion made and a second. Any further questions about supported employment? Hearing none, all in favor say aye, or do you do the roll call? Amy,
I need to do the
thank you.
roll call. Phyllis,
Yes,
Mary,
Yes.
Jan,
Yes.
and Vern.
Yes. Okay, next is supported living. Mark first.
I move that we fund supportive living for $180,000.
There's a
That's-
second?
I'll second it.
There's a second. Amy, would you call the roll?
Sure, Vern,
Yes?
Mary,
Yes.
Phyllis,
Yes,
Jan.
Yes.
Mark first, the transition program. 76,100.
I'll move we support the transition program for 76,100.
There's a second?
I second it.
Thank you. Amy, call the roll, please.
Vern,
Yes?
Phyllis,
yes,
Mary,
Yes.
Jan.
Yes.
Partnerships in health. 14,000 or 19,335.96. That's getting
I
down to,
move that we support that program.
thank you. Is there a second?
I'll second it. Or Phyllis too.
Amy?
Vern,
Yes?
Mary,
Yes.
Jan,
Yes.
and Phyllis.
yes,
Thank you. The next one is the Easter Seals Pediatric Therapy. 17,538. This is the one of training the parents.
Right.
I move for acceptance of that budget item.
Thank you. Is there a second?
I'll second.
Okay, thank you. Amy?
Vern,
Hey, I do have a question.
Yes.
This is also part of a applied behavioral analysis. Is that correct, Amy?
yes,
Yes.
yep. It's
So I-
taking those concepts and doing it, but not at the extent of the direct services that Mark first is talking about.
I think we need a little more explanation because when you see this ABA, I don't think we realize what all that covers and the different programs. So I would like to have a little more explanation as to what ABA really is, who pays for it, what it encompasses, etc.
So
Just
maybe
for,
help, sorry, Phyllis.
no,
See,
just for my benefit. So, I mean, I don't want to fund anything we shouldn't fund, but I don't think we're aware of the possibilities.
Yep, I think it may help also, so I will definitely reach out to Mark first. But I think it will also help if they just give a nice specific
This is
example.
Easter seals.
Yeah. The
There's a
apply-
I'm sorry, there's a fair amount of this. I was totally new to me, and I went online, and it's being applied to athletics. It's being applied to a whole variety of different things, but it's obvious that it's done differently depending upon what the application is. But I think that's a very good question.
See, the Easter Seals is doing it for 33 families and for, I can't remember the amount of time. Was it a matter of weeks?
Yes, and they were having like 3 different cycles of that, I believe.
Right, right.
Yes.
See, I just think there's too much that we don't know. I mean, it has nothing to do with the early intervention program that Mark first wants money, 184,000 for. I just want more information. So, and whoever that can be, Amy, I don't know if it's all Mark first, or if you or people in the health department can explain it. I have no idea. I don't know what I don't know.
I think maybe we could go back to, I'm trying to think of the 2 ladies' names that made the presentation for Easter Seals. And I think that one of them, I think, was the one that was going to be the director of this. And we could maybe go back to them and say, explain how ADA is going to be applied to training the parents.
Question being, have we passed the Easter Seals program then? Haven't we?
We haven't voted on it.
We haven't voted.
We just need to do the roll call, I believe. I think there was already a motion to approve it in a second. We just need to do the roll call. Dan,
Yes.
Phyllis,
Yes.
Mary,
Yes.
Vern.
Yes, and that's consistent with the fact that we want some more information about how ADA applies to this program.
Okay, so just real quickly, I think I may have gotten a little bit confused in that. You want more information from Mark first on that tabled item. Are you saying you also want more information from Easter Seals?
Oh, I think the question was, how is ADA going to be applied to this particular program? And it will be different than obviously what the pediatric therapy program is.
Okay,
Even more basic, I think we need information on what ABA is. Not just these two programs, but
Understand.
what
Yeah.
the basic idea is.
Okay, that takes care of that, which then leads us to something that we were beginning to talk about at our last meeting. And that is that we have, for the second time, we have a reserve that has shown up, 65,000, when people didn't apply for funding. And, you know, maybe why is that? But maybe this is an opportunity for us to say, okay, given the environment that we're living in, a lot of things have changed in the world. So what is it that we can find where we can actually use this taxpayer money to really good advantage? And how do we go about doing that? And Phyllis, I know you sent some information, and that may be a good place to start if you might. And I've done a lot of thinking about it as well. So.
Okay, thanks, Vern. I think my foremost thought is that with the pandemic especially, we don't know what the needs for 21 will be. And I think because we have extra money, we should, what they request, what we get requests for in grants is fine. But I don't think there's anything wrong with us holding some of this money for some last minute requests, because I don't think groups even know what they will need as the pandemic goes on. So I know that the county has written or unwritten guidelines as to how much of our budget should be held in reserve. But I think as long as we have intentions to spend that in 21, we should be okay. I don't think we know yet what we're going to spend it on. My thought.
Mm-hmm.
I would like to add that I would like maybe RFPs for grants, specific grants, to go out the 1st of January saying, we know this is uncharted territory and we have money to grant for unforeseen needs, and that those letters go to all the agencies that serve DD and ID individuals.
Yes, if we have to make sure that the ask is simplified, that they don't need to fill out such an extensive application. We need to really make that so much easier for some of these organizations.
I believe that LifeSil has said that they don't apply because our application is so involved. And if there could be some kind of a, so that they don't have to say where they get their funding, and if they had fundraisers this year, what their needs are.
Right, and I know they're having a fundraiser right now through, is it Tobin's Pizza?
I think that's right.
Yeah. So they obviously are in need of funding, but I don't think they have the money to spend for staff that can fill out the way we ask, the application that we give them.
Some of the thoughts I had would be, of the 65,000, we can begin to think, okay, do we say 10 to 15,000 as reserve, and we've got the rest that we could do in grants? But how do we learn more about them? A starting point might be, just as an example, what really grabbed me as well in our evaluations is that transition program, which there's no government money for that. And so I kind of think about, well, is there something that we can maybe add to that that will help improve that, and will even spread it out a bit more? And maybe the agency doesn't have the staff that they can do that with. That would be one place I'd look. The second thing would be I'd go to some of the agencies that have previously talked to us. LifeSil's one, Homes of Hope,
Homes of Hope, yeah.
and maybe talk to them and say, we'd like to know if there's a way that we can help you do some things. If you got some ideas about with them, but you don't have the money for it. And there's maybe some other ones that we would know about, the Baby Fold or whatever, if we've got some ideas about, okay, here's the money. So we could have grants that could be 5,000, or they could be up to whatever for things, but it would be our intent to say, we're going to put into a fund over here. I think, as you suggested, to fund and spend in 2021, that maybe it's 50,000 or maybe it's 55,000. And we don't know what that is right now, but we need to establish a process for how do we touch base with these people and learn what they need.
Another service that was brought up I was reminded of in the minutes is, I believe it was the July 31st minutes, that the IDDD people need more behavioral health services. And is our Center for Human Services doing anything more to service this population?
Yes. Yes.
And I believe the community healthcare clinic, dental clinic, closed down for several months. So there could be a backlog of people, some of these individuals needing dental help.
Certainly.
I think the grant program is a good idea. Just give each agency the opportunity to apply for it and tell us how or why they need it in a much simplified way.
And this may be a way of introducing ourselves back to some of the agencies who are no longer asking us for money and building rapport with them.
Right.
Yes.
I agree. Phyllis, you're muted. Okay, you're muted. There you go.
I'm trying, I'm getting there. Amy, one of the things I wondered about is that in one of those sets of meetings, or one of the minutes, you mentioned a new behavioral health specialist that the health department has, Taylor Davis. And one of her projects was to get the 377 board more publicity and more visibility. So I wonder if this isn't a good opportunity to bring her into this project, because I think there are probably needs out there that we don't know about and they don't know about us. So let's involve her if that's appropriate.
Yeah. So just real quick, what Phyllis is referring to is part of our logic model for the behavioral health program for 2021. So I think I can't remember if I informed you guys or not that the behavioral health program did grow. So I do now have a behavioral health program specialist to be able to take on and expand more activities. And so one of the things that we have planned out for 2021 is we have a list of different agencies and groups that assist individuals with any type of developmental delays or disabilities. And we're going to start reaching out to them and try to have collaboration and a connection. And so, yes, this would be a good start as far as, because when you guys say with like the RFP that would hopefully go out in January, just kind of being open and just saying like, tell us what you need, what's going on, what are your, being it simplified. And so I think we have, the list of people to read. So yes, that would definitely be a good start. Like, oh, there's money. Do you want to talk to us?
Would it be appropriate, given what we've just been talking about, to actually establish and put a title on it or whatever, a fund for 2021, and it doesn't have March 1st on it, it doesn't have whatever, but it has something that says these monies are going to be spent in 2021. Our intent is for that.
Yeah, definitely. That could, so, like we can definitely simplify the RFP process and try to have it a quick turnover. And so that would be something that would be included in the RFP is there's up to this amount of money to be able to award. And just real quickly too, so it was 65,000 that wasn't requested, but depending on what your guys' decision is on March 1st ABA therapy, there could be like 240, 250,000. So we won't know that also until December. And so I can try to get an RFP started for you guys to, a template for you guys to have at a December meeting to view that. So then hopefully that can get executed and sent out in January.
Yes, if you could frame that so that there's a process and everything, and that we could approve that. And good, I feel good about this approach.
I just want to make sure you are hearing that we need to make it as simple as possible. Because I think I'm very frustrated with the way we have to do the ask. It's just, it's way too complicated, I feel.
I agree with Jan, and to complicate matters, but make it so that we know what we're doing better. Is there someone in the health department or that we can pull in that could explain to us in bullet points what we can and cannot do for school-aged children, so that we don't all have to read the school code in the Illinois compiled statutes, which I got lost in. And so that, the transition program is wonderful, Vern, but are we limited to the age that we can do that, or is it because of the school code?
So according to the statute, it is just the services that are received when in the school cannot be duplicated outside of that. So there's not an age. The 377 board can provide funding to serve any age. And it's kind of what we were talking about earlier. It just can't be. And so I did look into this last year with legal regarding this concern. It just can't, the funding can serve anyone. It can serve family members of individuals with IDDD. It doesn't even have to specifically serve the person that has the developmental delay or disability. And as far as like with the school, it just can't duplicate what the child would be receiving at school. And the children, especially right now, the children are receiving very minimal services at the school. So anything that has come forth at this point has not been a duplication of what they would receive at school.
I appreciate that explanation, but I also know that having been a parent of a child with some disabilities, that if the school districts figure they can get someone else to do it, they won't fund it, even though they're supposed to fund a program. So we have to make sure that school districts aren't looking to us to take on what they should be doing.
No, that's correct. And so the things too that have come forward would be things that would be specific to supporting the family versus the educational needs that the schools are responsible for.
Okay.
I think this coordinates well, Amy, with what you're already kind of thinking about with exposing us more and getting our name out there. And this could be a way to do that, especially if we're looking for projects to fund. And people that want something funded, they may not have the idea shaped well yet, but maybe we can help with that too. Okay, good. We've already dipped into the items for action with approving the 377 board calendar program funding, with taking off the table the pediatric therapy for more information at this point, and then funding the applied behavior for Easter seals, but asking for more information about how ADA is going to be used in this project and what the expectations are, and learning more about ADA. Yes. So that takes us to the approval of the bylaw revisions, which we have in our packet, the bylaws, and I think
I would refer us to Article 3 under officers. And it says that the officers shall be elected annually at the July meeting. But there are other references in minutes that officers were elected for 2-year terms. So we just, they were elected from 2020 to 2022. And that is on the county's website, that they have been elected for 2 years. And our bylaws say that they are to be elected annually. So all we need to do is just change the 2022 where it is to, and I believe it's also in our minutes somewhere, to 2021. And we have an election every year.
I think I saw that too, but I can't find it right now. But I think we just make sure we're consistent.
Yes, well, and that it does say, oh, I just found it in the minutes from July 31st. Under items for action, it says elect 377 secretary to serve until July 2022. And it says elect president to serve until July 2022.
I'm wondering if that is a typo in the minutes. So if I recall from July, it was every year. We were going by the bylaws and every year in July. So I think that's actually a typo, that it should just be until 2021.
That's fine.
Yep.
It just needs to be cleaned up.
Thank you guys for seeing that.
You know, it also says that the officers shall be elected annually, and then the president of the board and secretary shall serve no more than 2 consecutive terms. I thought we changed that.
That was changed in a different one too. It still states in there that it's only 2 consecutive terms because that was deleted in a different one.
Hmm. So do we follow that? What's the rule?
It isn't in statute that it has to be that way. I think it was just something that was agreed on at some point, but there was a bylaw amendment, if you guys remember last year, that was taken out. So I need to look into that because that shouldn't. So if that's in the bylaws that I gave you guys moving forward, then it may have been the wrong bylaw that got edited.
It's Article 3 and the officers.
Okay.
In number 1.
And then I will also fix the minutes from July 30th to say 2021 instead of 2021. You're not.
And also, we have not had an annual report since the year 2018. There was no annual report for 2019. And that's in the bylaws that there will be an annual report.
We did have I did provide an annual report to the health department to be distributed, and then and I have, so this is my second year in this position. There was an annual report that was provided in last year's for 2019. And then, hold on one second, baby. Okay, hold on one second.
I don't believe there was a 2019 report that was published.
That one was public. I would have to go back to the health department to see where it was publicized, but that one was. But I don't know the 2019 one. Okay, you're right. The 2019 one, I need to see if they publicized that or not, or something happened with the pandemic that's delayed.
So do we need to adjust the minutes for July or the bylaws? Or both?
We're just talking about the bylaws, aren't we? Yeah. I'm okay with Article 2 members, the highlighted area, number 3 and number 4, which addresses attendance at meetings. Phyllis isn't on.
I didn't realize that was a change in bylaws. I thought that was just the way they currently state.
Article 2, the members, I mean, any board member, the attendance, I mean,
I thought that was currently
number
in the
3.
bylaw.
Okay. It was highlighted. I thought that was maybe what we were addressing.
The highlighted part was supposed to be the part that was adjusted, but I'll look at the other part about the.
You're muted. Okay. Yeah.
I'll look at the other part to make sure the terms were in there.
Also, would the other members look at their minutes? As I look through the minutes that came to me via computer, I have minutes for July 31st and October 29th, but I don't think I have.
I also have October 7th.
You do have those minutes?
I have October 7th, yes, as well.
Okay, all right. They just didn't get printed off at my house.
Yeah, I don't find October 7th either, but if Vern got it, I know we did too, so.
It's
Well,
right,
it's-
it should be in the
they come
middle.
out at different times. Amy, did you resend them?
No, she just resent the last minutes, I think. She
Okay, that's right. then.
completed. Everything else was completed. And I have those because I've not printed anything off. I keep going, I just go back to my computer and
Right.
look at them.
Well, I have the
I don't,
July 31st ones came out because we're being asked to approve minutes all the way back to July 31st.
Right,
correct.
three sets.
Yes. We can't remember what happened then. Oh. Why are we having such a delay in minutes?
So that was between, new OSS and, someone else doing minutes. And so there was a delay just in the craziness of being short-staffed in the pandemic. And usually you guys would approve minutes like the minutes would be done to try to approve at the next board meeting, but there was just didn't work out this time.
Well, the October 7th meeting was a special meeting to deal with the request of Mark First on changing the reallocation of the $91,000.
Yeah, so the original packet that I sent you out had 3 sets of minutes. It was the July 7th, the 2 October. And so it was in order, or in chronological order. So the October 7th one should have been in the middle of that. But the first I sent out to you, I didn't realize the October 29th minutes weren't finished. And so then that's when I sent you the finished minutes. But as far as the July minutes, I have that the change that needs to be for the officers that were elected, that's only until July of 2021 and not until 2022. So
Correct.
that corrected. And then as far as the bylaws, I know we still have to do the approval of all of this, but as far as the bylaws, the highlighted parts are the ones that were the changes. And so I need to make sure that I gave you guys the correct one as far as I'm looking at where it says Article 3 officers have any I don't see any language there where it says as far as terms. The ones that are in your packet, I don't see a term. Does someone see where it says something about a term for the president and secretary? And the ones that I sent you, the ones I sent you should be the most updated ones.
Well, it does say that they're elected annually at the July board meeting.
Yes, and that has not been changed. But I thought I heard someone else say something about, and I appreciate you guys being patient as I'm trying to do this meeting and help a second grader type, but he's on break now, so.
Okay, this is, just a minute, let's back up. Article 1, purpose, Article 2, members, Article 3. Oh. Okay. Mine are printed off funny. Article 3, Article 4. Okay, I guess I had a combination of bylaws here. So I'm going off what you sent us, Amy, so I hear what you're saying. Because the end of the officers it does not say anything about term of, length of office, right? Is that what you're saying?
She's back now. I don't think she heard you, Jan.
Okay. Amy, I said I think I had some older bylaws here mixed in with the present bylaws that you've presented. And I see that under the officers, it does not say how long the term in office is.
Okay, great. You do have, that would be the updated ones.
I
That
think we changed that 2 years ago.
Yep,
It just says the officers shall be elected annually.
Right.
Right.
And that's correct.
as far as even like the elected annually, the other reason why I think that is a typo, confident that that's a typo in the minutes, is I think that may be part of the statute for the 377 board, that they're elected annually in July. So I think that's why it's in the bylaws, is because sometimes the bylaws can be, as long as they're following the statute, you can have, different things in there, but I'm pretty sure that was taken directly from the statute.
Well, and logistically, it should be annually because we have 3-year terms and it would get to be a nightmare to only elect officers who were going to be on the board for the next 2 years.
Right.
Yep, really good point.
So are we okay with the bylaws?
Yes, just that
So-
we should make sure there's an annual report. If there wasn't one for 2019, fine, but there certainly needs to be one for 2020 with an explanation of why 2019 didn't happen.
Yeah, Mary, and I think, I know I definitely turned in something to the health department, but I will check in on that again to see if that was in, if it was made public, and I will get back to you guys. I'll send
Okay.
you an email about that.
Okay. A motion to approve the bylaws.
I so move.
Thank you. Is there a second? Thank you, Phyllis. Any further discussion? Hearing none, all in favor say aye.
Gotta do roll.
Roll call.
Vern,
Yes.
Phyllis,
Yes.
Mary,
Yes,
and Jan.
Yes.
Now we have 3 sets of minutes to approve. This July 31.
I move approval as corrected.
Amy is shaking her head yes. Okay. Is there a second?
Second.
Thank you. Amy?
Okay, Jan,
I'm just looking at, I thought I had seen something in here.
Okay.
July 31.
Yes.
Okay. Would you ask if I'm say yes? What are you waiting for me to respond to?
We're
We're just
approving
doing-
the minutes.
Okay, yes,
Just doing roll call. Phyllis? Just approve, it's just doing roll call for July 31st.
Unmute, yeah, Phyllis.
Yes.
Thank you, Phyllis. Mary
Yes,
and Vern.
Yes,
Okay, great.
October 7th minutes. That was the special meeting.
Motion to approve?
Thank you. Is there a second?
I'll second it.
Thank you. Any discussion? Call the roll, Amy, please.
Jan,
Yes,
Phyllis,
Yes.
Mary,
yes,
and Vern.
Yes. And then the October 29th meeting. They're longer.
I move that we approve October,
Thank you. Is there a second?
Second?
Okay. Any further discussion?
I have one question under Mark First Supportive Living. In the first paragraph, down about halfway and in the middle of the sentence, it says current funding requesting from 377 board is not currently funded under this model. And I just kind of wondered what, I thought we had helped Mark First with all the new things they needed.
I guess I'm not quite following.
Well, I'm not sure why that statement is in there.
where is it again, Mary? What does the paragraph start with?
It's, the paragraph starts with currently 46 residents
Yeah.
in 24-hour program.
Okay,
2, 3, 4, 5. The sixth
Oh.
line down. It
right.
says current funding requesting from 377 board is not currently funded under this model. And I didn't understand why that was in there.
So I think that it is saying that it's not funded under, so the way that they have the model set up, which is with the supervisors and providing the different supports other than just having the direct service professional in the home. So you guys are providing funding to services or to a supported employment, the model that isn't being funded by the state or the federal government. So that's saying like what you're funding does not have another funding source, but it sounds like Mary, you're reading it as something differently than that.
Is that,
If
is
that's
that,
the interpretation,
is that explained in the next paragraph? The new wellness specialist position would help the wellness coordinator with tasks. They may be thinking that this new position changes the model.
okay.
Are you wanting that sentence deleted or are you wanting that sentence changed?
I would think it would be deleted, but I don't know.
I thought, like Vern, that it's probably has to do with the new staff position that it is explained in the next paragraph.
Okay,
So I think it's okay to leave it as it is.
The sentence may not be helpful in there. It may just raise questions and it doesn't really add much.
I think it just, as you say, Vern, raises questions and it would be better to
Yeah.
not have it in there.
I think it really relates to this new position that they've got.
Okay,
Shall we say we delete current funding requesting?
yes, please.
And I will put that in there. Can you guys read me the sentence one more time to make sure the correct one is deleted?
Current funding requesting from 377 board is not currently funded under this model.
Okay.
Any other changes or additions? A roll call then, Amy?
Okay, Jan, wait. Did we get a motion to approve those minutes?
I so move.
I second.
We have now.
Okay, thank you. Vern,
Yes.
Jan,
Yes.
Phyllis,
Yes,
and Mary.
Yes.
Okay, that takes care of the minutes. Is there any other business to come before the board?
We will meet in December then?
Yes, so we will definitely have to meet in December. So what will happen next is I'll have Jeff reach out to you guys to coordinate a time and make sure that IT is available to be able to stream that time. And also just to give enough, I feel like I just keep saying the word time, but just give enough time to be able to start formatting an RFP template and getting information about ABA.
Are we going to have people from Mark First in to discuss our questions and Easter seals as an information for them?
So my plan was to write the questions to them and get written documentation
Okay.
of the questions to provide to you guys. Just with the setup of the open meeting and making sure that we don't have too much competing schedules. That was going to be my steps, unless you guys are adamant that you would like for them to speak versus providing written documentation.
It would really help to speak with them.
So I will try to do both. So, and I know for some people it's easier to read. And that way it also gives both of them a chance to be able to know what is being asked of them ahead of time and to be able to formulate that. So I will ask them ahead of time. And so I'll have Jeff and moving forward and coordinating a time with you guys in IT and then providing that time to Mark First staff or Easter Hill staff and see if they're available to speak during the meeting.
Okay. Yeah, if we just do written, then that doesn't give us a chance to, when we read, we're going to have questions. So then who's going to answer those questions? That's why we need to speak with them, in my opinion.
I agree with Jan.
Okay, I will try to coordinate that.
Very well. Anything other to come before the board? Been
Could some-
productive. Thank you.
In taking the minutes, we don't need a written transcript of the meeting. We need to create some kind of a template. I mean, they were way too long. In my opinion.
unless it's legally required. I don't know
Oh.
what the requirement are according to this open meeting act.
So as far as with the July 31st and the October 7th, those feel like a transcript. The October 29th ones were definitely a transcript. And that is to show just the process of like the questions that asked during the presentations. And also just in thinking about 2021, because it sounds you guys have more questions about new programs versus existing programs. And so it may just make sense to spend more time on like new programs in the presentations and asking questions. So the 29th ones were definitely more transcriptive because of the nature of the meeting. But however, as far as the other two sets of minutes, did those feel like they were transcripts or just the 29th, the October 29th?
Yeah, in minutes, I'm more used to just a kind of an outline of the meeting and how people voted, how people voted or what they voted on. I'm just surprised how it's just kind of word for word of our meeting.
Okay.
This isn't the first time that this board has asked for more abbreviated minutes. The
Minutes,
previous person, Phaedra, who took minutes, took very lengthy minutes, and we asked her to shorten them up. So this is not the first time, okay? But I do believe that the October 29th minutes were very helpful in reminding us of what had gone on at the request for money meeting.
Okay. And so I think some of it too, so is just different people's writing styles. So writing styles. And so
But would it help if we suggest a template of some kind so they know exactly what we're looking for in minutes? I think what the problem is, all of our meetings are recorded, so they put on the earphones and they just start typing what they hear. And those of us that are older, we were used to just outlining, just taking bullet points from the discussion instead of a written transcript. We got some work to do on this, I think.
yeah, I think that because
Check-
even as like just reviewing,
Legally.
But Phyllis,
Just check with Amy, check with what is legal. I mean,
Yeah.
if it's legal that they're supposed to provide an actual transcript, then okay. But
Yeah.
check with what's legal and then let's go with that.
okay, and I think too, and I know it definitely doesn't have to be word for word. And even like as I was looking through excluding the October 29th minutes, as I was looking through the other ones, it felt like it was just kind of a broad overview, but there was still a significant amount of information. But it felt like there was a lot of information, but it didn't feel transcriptive and saying like Jan stated this or Phyllis stated this. So I think some of it too is like, and I heard you guys talk about this before, as Mary brought up, like this isn't the first time that this has been brought up. So I've heard you talk about this before, but I think what Jan's saying with like clear direction on what your expectations are of what is in the minutes would be helpful for us to have some guidance versus just them being shortened. And then we can look into legal to make sure that that's appropriate.
and I don't think there's supposed to be direct quotes from what board members say, in my understanding.
Okay. So if you guys can provide some guidance, like what you were saying, like specific guidance on how you want to see the overview of the discussions or the items, I think that would be helpful.
Let's find out what legal has to say first.
So according to it is hard to, and I'm only saying this because it is very hard to get an answer from legal because it's just very hard, but according to Open Meeting Act, it just has to be an overview. So it definitely doesn't have to be a transcript.
The overview would be good. Phyllis, are you still on?
Yeah, for some reason I'm frozen.
You're frozen.
on-
I like
yeah, but I'm here. Yeah, whatever they say we have to have, then that's what we should go with.
but an overview would be good.
Okay.
Okay.
Would looking at the Board of Health minutes give us any guidance?
So the Board of Health minutes are they're done the same way. And so sometimes we can still meet legal and sometimes it's just the board's preference too. So I know with like the October 29th, they were definitely transcribed. Here's where the challenge is in the gray area. And I'm not trying to be combative. I'm just trying to troubleshoot. Is that where the challenge is subjective in that like we can be like, well, this is an overview. This is an overview, but you guys are also saying you want even less of an overview than what we're providing. So you want statements like this was discussed and then not really going into detail of what is discussed. Is that what I'm hearing? I'm not trying, I just need, we've had this conversation, and so like it just helps to have clear direction on exactly what you guys are looking for.
An overview is all I can say right at this moment.
Why don't you sit, Jan, you be in contact with the person who writes the minutes and give your expectations?
Oh, noted.
Yeah, that sounds like a good plan. Even maybe looking not at the October 29th minutes, because those were transcripted for a reason, but looking at some of the previous minutes and just going over like just going over specifics. So when this was written this way, can we maybe look at shortening it by doing this? But I think having like specific examples of what the expectation is what is needed at this point, because we're not meeting those expectations and we're not sure what else to do.
My fear is when you get into a larger transcripts, there's a chance for error too, because it really takes some careful reading more than once. Whereas if you have an overview, it's less of a chance of error.
Yeah, and I'm definitely not disagreeing with you, Jan. We just need,
Right, I know you. Okay. Are we done?
We're nearly there. All we're missing is a motion for adjournment.
I'll move that we adjourn.
Thank you. Is there a second?
I second.
Thank you. Amy?
Stay safe,
Um,
everyone. Oh,
I don't know if we need to do a roll call for this, but we'll go
I
ahead.
don't
Just
think we do.
no, I don't.
For your time this morning, and we've cut down some things that are important, and we're going to be working on some things to give us some real focus for 2021, I believe. Have a good Thanksgiving.
you guys too.
Stay
Yeah.
safe.
Take care.
Happy Thanksgiving.
All right. Bye.
Thanks.